Hello everyone, my name is Jeff Touchcorner. This video which I am shooting, it's a reference to the prevalence of fibroids linked to victims of abuse. This is to serve the purpose of students who are doing medicine and studying the social medicine module, which in particular it's dedicated to Anua Medical University in China. Right, to start with, maybe I can try and give a rudimentary background of fibroids. Fibroids are benign hormone-dependent tumors that are clinically symptomatic in 20% of the reproductive age group of women. Established risk factors for fibroids include age, ethnicity, meaning that they are more prevalent in African and Asian ethnic groups than any other groups. Why is that so? Nothing much is known about or have been discussed pertaining to the topic, but however, from the local knowledge and the research which has been carried out so far, it is highlighted that fibroids are linked to ethnicity, family history, body mass index, which somehow increase the fibroid risk, being highest in overweight women. The incidence and clinical progression of fibroids is associated with young age, infertility, and lower parity. Age at menarche has been associated with elevated weight gain at early age or at early stage. The allostatic load hypothesis postulates that chronic social stressors may adversely affect the psychological system responsible for maintaining homeostasis and thereby negatively influencing health over time. Stressors cause functional changes in neural, endocrine, and immune process, as well as emotional and behavior responses. Maybe going back to the background of understanding this topic about the prevalence of fibroids, we also need to know more about the victim of abuse. Probably what we might try to dwell onto is the impact as well on the domestic abuse, or children or individuals who witness abuse. Maybe we can, in doing so, we can try to answer the question as to what are the effects of abuse. How does someone react when he or she undergoes abuse? Right, the individuals, they become anxious and depressed. They may have difficulty in sleeping. They may they might have nightmares and flashbacks. They can easily get startled. They may complain of physical symptoms such as tummy aches and may start to wet their bed. They may have temper tantrums and problems with school. They may behave as though they are much younger than they are. They may become aggressive or may internalize their distress and withdraw from other people. Older children may begin to play turn down, start to use alcohol, drugs, begin self-harm by taking overdoses or cutting themselves or having eating disorder. Children may feel angry, guilty, insecure, alone, frightened, and powerless, and in some cases can be confused. So, in a way, in a summary to the effects of domestic abuse or violence, um, survivors may suffer from an array of psychosomatic illnesses, eating disorder, insomnia, gastrointestinal disturbances, generalized chronic pain, devastating mental health problems like post-traumatic stress disorder, PTSD, panic attacks, depression, and anxiety. But then let's look further and try to bring in, because already it seems as if all these which I've said pertaining to abuse and all the like, they actually they instigate or sort of activate stress. And how does then stress activate um, fibroids? In order to do so, we can pose a question and try to answer it. Does stress cause violence? In trying to answer that, we can actually realize that stimulating an aggressive controller in the brain lead to higher stress hormones, and injecting stress hormones facilitated aggression. Such a mutual facilitation may contribute to the precipitation and escalation of violence behavior and stressful conditions. So going back to the African Asian ethnicity, we so far have found that this, what I've said so far, compounded with the cultural beliefs whereby for fibroids, they somehow in a way have got symptoms which can be mistaken with other diseases. Maybe before I go further, I can try and explain what some of the symptoms are for fibroids. This may include things like heavy bleeding during menstrual periods, constipation, back pain, and also pain when doing sexual intercourse. So some of these symptoms, as they prevail for African Asian groups, for them to approach the healthy professionals, which unfortunately is dominated by male professionals, they find it difficult to explain what they are suffering from. So in a way, they will try to cover up or try to water down the language so as to it to be acceptable, because at the end of the day, if they say it as it is, they fear to be targeted or to be labeled, because some of the symptoms might be related to sexually transmitted diseases, or some of the diseases which tend to make somebody feel unclean. So hence this as well can inhibit people approaching for medical attention. And adding on to that, in Africa and Asia, we still have or lack medical facilities which are enough for every victim of abuse to go and attend and get help. So as a result, due to the fact that fibroids which grow towards the wall of the uterus, they don't cause much problems. Hence, somebody can just tend to live with it and don't even bother to go and report about or seek medical attention. And also compounded to what I've already done, that people are stigmatized because of the nature of the symptoms. If they grow towards the inner part of the uterus, towards the urethra and all the like, then it will tend to push in and give pressure, such that when during menstrual cycles, you experience pains and all sorts of discomfort. Going back as well to the financial aspect, most of the victims, you look at it in the African context, they so happen to be in a group which comes from poor families, of which financially they don't or can't afford to medical treatment which is adequate enough. And compounded to the fact that even though those facilities which are there, they are not well equipped to deal with the problem in terms of diagnosis and treatment. On the other note, it can also have something to do with openness. The culture somehow overshadows the whole essence of people being open to diseases and problems within their bodies. So you find when it comes to young adolescents or young children discussing this with their elders, especially the male counterparts, the fathers, or even the mothers, they find it a bit very embarrassing and uncomfortable. It's only then if in the family probably there is someone who is literate enough and well educated to talk about it, that things can become open. Then going back to how this can be mitigated, it would be ideal if such diagnosis of fibroids is done early enough and reported, that those young victims can be counseled, can go through counseling sessions. Counseling can actually reduce and suppress some of the stress which is caused by this abuse. Hence, the activation of hormones which tend to favor the environment for fibroids to flourish can be minimized. So in conclusion, solution, how can this be addressed? It is ideal that educational programs focusing healthy relationships be introduced throughout Africa and Asia. Challenging gender inequality, sexual stereotyping, domestic abuse should be dealt with accordingly and at all age groups. All these should be integrated with work on anti-bullying and conflict resolution as a mandatory part of the syllabuses in all schools. This will act as important to prevent and to take sensitive measures in abating such a problem, which is somehow hidden under the carpet, yet it exists in African and Asian communities. Thank you very much for listening.